Hello and welcome to Folio Magazine. I'm Rob Nicholson. I have with us today Dr. Xing Cardona. Dr. Cardona is the medical director of Cardona DPC, or Direct Primary Care. Welcome, Dr. Cardona.
Thanks.
Doctor, explain to me the difference between direct primary care and healthcare as we might traditionally know it.
Direct primary care is, if you think about the words, exactly what it sounds like. It's direct care, a direct relationship with your primary care physician. So unlike traditional medicine that we know now, which isn't exactly direct, there are lots of layers between the patient and the physician, meaning staff, administration, front desk, insurance companies, billing. So there's lots of layers between the patient and the physician that often get in the way of care. In the direct primary care model, it's really just a patient and a physician, and we really try to simplify that as much as possible to really just deliver primary care, just deliver health care.
I find, doctor, in looking at your website, that the prices are very affordable, and in fact, you even have programs for the small business person who might want to cover their staff.
Yes. Because we can eliminate a lot of those obstacles between the patient and the physician, that's how we can keep the overhead really low, and we can pass on that savings to the patient. So we can save the patient a lot of money, and therefore we can offer those savings to even small businesses. So we can offer small business owners the ability to offer healthcare to their employees, something that they might not have been able to do previously.
You offer not just medical care, but a facility where actually labs and things that people would have to go to other places to get done can actually be done in your office. I wonder if you could tell us more about that.
It includes everything that I can offer in the office. So the direct primary care model is essentially a membership-based model. It's a monthly fee. And for the monthly fee, as you mentioned, it's $99 a month for an adult. It covers any visit in the office, and that's an annual visit, a routine office visit, an urgent care visit. I also do televisits. Covers all of those visits. It covers minor procedures that I can do in the office. Let's say sutures, anything that maybe I could cover in the office, something that maybe urgent care could do, I could also do. It could cover some injections in the office. Paperwork, anything that a primary care physician would be comfortable doing in the office, it would cover all of those services. I think a lot of patients are more reserved in traditional practices because of maybe the cost associated with each visit. Even though the majority of patients do have health insurance and they are covered, there still is a cost associated with each visit, a copay, for example. But even above a financial cost, there's still a time cost associated with each visit. So in direct primary care clinics, traditionally they are smaller. Access is a lot easier. Appointment times are a lot longer, so you can spend a lot more time with your physician. And down the line, it pays off because your visits are much more efficient, so you don't have to visit the doctor as often. And because the practices are much smaller, you're not competing with a lot of other patients for appointments. So there aren't a large number of patients in the waiting room, and you're not waiting for long periods of time for an appointment. So it's a much more, I think, efficiently run way of seeing patients. Theoretically, you could see me every day if you wanted to, for $99 a month. I'd be happy to see you every day. Hopefully I wouldn't have to see you every day if we got everything under control. And yes, so the idea is to encourage patients to come and be proactive about their health instead of reactive about their health. And I think I find that in the traditional model, because there is a cost associated, a lot of patients will wait, unfortunately, and wait until things are unmanageable on their own, and then they do come in to see the physician. And sometimes sometimes it's too late, and that's certainly not what primary care physicians, that's not what we would like to see. We are on the preventative end of medicine. That's how we would like to approach patients. And the idea is to form a relationship with the patient, come up with a plan, a health plan, come up with the goals, and really address the goals before they become problems, before they become health problems, and really have maintenance. And really, it's not unlike how you maintain a car. You really want to care for your automobile in a preventative manner rather than a reactive manner, because, as we all know, because it's more costly that way than it is the other way around. In my clinic, we do have a small lab in my office. We do have the ability to draw blood in my office. I have one MA, I have one staff member, and again, that goes towards trying to keep things as streamlined as possible. But my medical assistant is a phlebotomist as well, so she can draw labs. I can draw labs if she's not around. And so we really try to make it as logical as possible, as convenient for the patient as possible. It just makes sense. If you're there and I'm asking for labs, we should be able to take the lab. And so we draw the labs on site, and then we will have them sent to the lab. And I do have patients who are still insured, and so we will work with your insurance company and use whichever lab is in network and have them picked up and go from there. I do have a small pharmacy in my office. You don't have to use it, but it is another option. I can dispense medications. I do have generic medications in the office. And I think the prices are very competitive with retail pharmacies. So again, if patients are in the office and they just don't want to make another stop after they leave the office, I certainly can dispense medications and tell them what the prices are. It's all about being price transparent. And I will price that medication, that prescription for patients, and give them the option to go to their preferred pharmacy, or if they wanted to purchase it from me and go straight home, whichever is better for the patient. It brings it back to what medicine was, and it should be, in my opinion. And it really sort of goes back to what I think of traditional medicine, which is your small town medicine, your physician, and it was a physician and a patient, and it was simple. It's a simple exchange of services. Your physician was an expert in his or her field, and a patient needed advice, and that's as simple as it gets.
I've heard DPC is kind of a fast pass, like an amusement park. I wonder if you could explain.
Your members, DPC members, are afforded, because they are paying monthly, they're afforded some benefits because we are a smaller practice, and because we are focused more on the relationship with the patient. And we really are very, very patient focused. And so we are trying to really be as convenient as possible for the patient. And so I will do things like I'll meet patients in the office after hours if I need to. I will meet patients in the office before hours if it's convenient for the work schedule. I've been known to meet patients on the weekends in the office if it's more convenient for them. If they can't leave the workplace, because a lot of my patients can't, time off of work is money not made, I'll schedule a televisit during their lunch break. And so I do think it's things like that it's very similar to a fast pass at a theme park, where it's skipping the line, it's getting head of the line privileges for the same services you would get. It's streamlining these things that I think everybody should have. It's not a privilege. I think it's a right that everybody should have access to their physician. I think that direct primary care just makes it a little bit easier to get that. My clinic is located at 10175 Fortune Parkway, and it's just across from the avenues. It's in a small business park. I'm in Unit 1101. I would love to have anybody there. I am taking new patients. I am very passionate about direct primary care. I think it is the way to go for primary care. I think that healthcare needs a change, and I do think that patients need to know that there are options. And I think people are struggling right now in trying to find the best way for them to connect with their physician and their medical providers. And so yes, I am taking new patients, but I also want patients to know, at least locally, that I am not the only direct primary care clinic in town. There are several others, not as many as I would like. I would love everyone to convert to a direct primary care clinic, but there are others. And if my clinic is not convenient to them, as far as location, there are others in town. So Google direct primary care Jacksonville, and I'm sure there might be one more convenient to them. I would love it if everyone started to use a direct primary care clinic, even if it wasn't mine. But I am at 10175 Fortune Parkway, and it's Cardona Direct Primary Care.
Dr. Cardona, thank you so much for joining us. It's been incredible to learn about direct primary care as an alternative way to get practical health care. I'm Rob Nicholson with Folio Magazine. We'll see you next time.